My name is Emily, this is Madison, and our topic is virtual reality and occupational therapy, specifically through the therapeutic process and in education. So virtual reality has become an emerging practice area in occupational therapy. It can be defined as a range of computing technologies that present artificially generated sensory information in a form that people perceive as similar to real-world objects or events. So I'm sure we've all kind of seen or been a little bit familiar with some virtual reality, especially like in gaming, but it allows users to explore and manipulate a computer-generated environment, interacting visually, auditorily, and empathetically. So it's become an emerging practice for OT because it provides a safe, controlled, and consistent environment for patients, and it has also been shown to increase patient motivation and patient participation.
So since VR is kind of a new tool for occupational therapy, I thought we'd go ahead and just kind of show some theories and models that support it so that as we go throughout this, you can kind of relate those back to what we're talking about. So one theory that I immediately thought of was learning by doing, the experiential learning theory. These four elements: reflection, critical analysis and synthesis, opportunities for responsibility of outcomes, opportunities to engage holistically, and experiential learning is designed learning experience to learn from natural trial and error. Trial and error is going to be a very big part of virtual reality and how it can be beneficial for OT because it gives you that repeated practice opportunity. Another model that is very personal to OT are the ecological models to provide that holistic view of the person because we pride ourselves on that holistic view compared to other disciplines and how we can make it client-centered. So again, the person influences and is influenced by the environment. Virtual reality provides an immersive environment so that the person can interact with it and the environment can interact with them in that controlled and safe way to learn from trial and error. So this allows us to take in those personal values, interests, skills, abilities, and life experiences to kind of mold the therapeutic process to fit the client and their needs.
So one major part of the therapeutic process, as we know, is our assessment of the client. In OT, the assessments tend to usually be more subjective in nature and with a more objective norm to follow that. So for example, in like goniometry, we're the ones placing the goniometer onto the client, reading those measurements, and then comparing those to those more objective norms. However, VR offers a more objective measurement as a whole. So some of the uses for VR in assessment have been they've used head-mounted displays for stroke, multiple sclerosis, spinal cord injury, and Parkinson's disease. Specifically, the VR was able to detect slower and less rhythmic movements in patients with Parkinson's, and in post-stroke patients, they noticed a difference in upper extremity movements. And then going back to the goniometry, it was used, this picture here, it's an Oculus Rift, so your headset model with the XR Health clinical program, and it was used for shoulder range of motion. And they found that the VR method was equal or superior to the traditional measuring methods. As well, there was a 65% preference measure, and it was comparable in measurement time. So it didn't take any longer because Goni, like, it doesn't take a super long time, but the VR was comparable in that time.
Okay, so just some intervention areas that were highlighted in the research we found. Just to say, there was very limited research. We found a total of 24 articles, I think, that even mentioned VR, and most of it was not for occupational therapy specific. So this is a very new area. So we did see it a lot in ADLs because of what we had talked about earlier. Also in cognitive, social, and behavior interventions because it provides successes in task automation, grading of motor and cognitive challenge, progress monitoring, performance tracking, practice in a safe environment, engagement in session, and an unlimited design of virtual spaces. Virtual reality allows the patient to think with the extra time to learn from that trial and error and to offer other opportunities to enhance safety and promote performance. And some of the research, patients also reported a confidence boost and a reduction in anxieties after virtual reality interventions compared to typical interventions because they're allowed in that safe environment and they can rehearse that environment and feel more confident in real life environments. after the virtual reality, and then this allows them to return to their daily occupations and improve without the pressure of the life consequences. With each diagnosis, it's different, and that's going to be the main thing about how virtual reality can be used, is it's going to depend on the diagnosis rather than the person, age, or any other client factor. So that can reduce falls, burns, forgetting steps, etc. We'll show you a tool pretty soon that'll kind of explain more of those. And then again, this just provides with the repeated practice for constantly changing environments, because you can constantly change that virtual environment to fit the same way that our real life environments change. So this is the tool that I thought was very interesting because it actually showed how VR is used in OT. This is a fairly new tool that was developed in 2012. That's when the patent was provided to the United States government. So it enables functional and safe practice of ADLs through a conventional web browser and motion tracking system called the Virtual Occupational Therapy Assistant. So this system is designed to enable remote interaction between patient and therapist. They can reduce costs associated with patient-therapist travel, which is the same as kind of telehealth in a way. And then it can increase access to remote and underserved areas, enhance cortical reorganization in physical practice and mental imagery, and provide reliable progress monitoring of patient activity and functional status. The tasks that are implemented in this program right now are grocery shopping, kitchen tasks, driving, and commuting mobility. So this is a video of this tool.
Hi. Well,
so this is the kitchen.
now place the frying pan on the stove top.
So you can hear her cues throughout. They receive points.
Now get the olive oil and pour some into the
Notice
frying
that
pan.
some of the actions that they receive points for, she's not giving cues for. So this is, they're receiving just as you would in
Please pour some oil in the pan.
this, but it's also dependent on the patient to enhance their performance by doing these extra things and rewarding them with those points.
I think the oil is hot enough. Let's get 2 eggs started.
Notice
By the way,
bottom
I like mine
right
over
corner,
medium.
this is using a connect sensor.
Please crack the Please crack the egg. While the eggs are cooking, let's get the toast going too. Put 2 pieces of bread in the toaster and get them started.
That they wish it was more sensible.
Please place the bread in the toaster. Please place the bread in the toast. Please use the spatula to pick up the eggs in the pan. Please place the eggs on the plate. We're done with the spatula. Please put it in the sink.
Entirely calibrated right, so if you notice, he didn't get those eggs in.
We just got back from the grocery store, and now we need to put everything away.
Okay, so the rest of that video just shows the grocery. They put up groceries in the cabinet, so that one is more of following directions. So they will say to put the eggs in the fridge. So they have to actually find the fridge in the environment, go to the fridge and do it. It doesn't show you everything at once like the kitchen task did.
So as Madison pointed out earlier, there isn't a ton of research on virtual reality, specifically in OT, but with the research that there was, almost all of them were addressed to upper extremity rehabilitation. And for the most part, almost every single article we looked at, the virtual reality interventions were very effective in upper extremity rehab, and sometimes they were preferred by the patients. So with that, there's really 2 types of VR. We have game-based and non-game-based, which is kind of what we saw on the video there. There has been some studies to show that the non-game-based have been more effective overall than the game-based, a little more effective than the game-based. And then there's also been some studies that have shown that a combination of the 2 might be best. And this really supports our holistic approach that we need, a little bit more of everything. It's not just our activities and it's not just our road exercises. So this is a little more into the game-based versus the non-game-based. So our game-based interventions, they offer a fun and more exciting twist on traditional OT. Have a lady playing baseball with the Wii there. They also can provide and increase social interaction with other participants because you're playing against somebody, as well as increase client motivation and participation. And then with the non-game based, again, that was what we saw in the video, and that's more your functional activities. So what you're, like doing like kitchen or different things like that. These tend to be more realistic and sometimes more motivating. Honestly, though, a lot of the research pointed that both were motivating to some clients and both had obviously positive effects. But some people did prefer the non-game based because it did provide that alternative to the rote exercises.
All right, so our last portion goes over how VR can serve the occupational therapist as a person rather than as an interventionist. So currently in healthcare worker education, VR is really only used in nursing and surgery to provide simulation. So, but what VR does offer for education is it's immersive. You're getting sensory from all different types. You're in the environment yourself and you're going through it yourself and doing it just as you would in the real world, but you're able to think it through without having to worry, this is a patient's life in my hands. So this also offers opportunities to cater to different learning styles. You can change the environment or the design of the program based on what type of learner you are best. And then this also offers collaborative learning. So with the way that simulations are used in nursing and surgery now, and even just for healthcare education in general with computerized systems, like our most common one is CPR training. You go in with the mannequin and that's how you do it, but you follow the directions on the screen. So with VR, it offers collaborative learning because you can either have multiple people wearing a VR system and you're in the same setting, just not in the same space, the same virtual environment together, and you can work together. Or it also offers for computerized sims to be in there as well so that you can work with them and you're working with another person rather than just by yourself working through it. So for OT research, again, there wasn't much about OT specific in VR education, but we could use this for fall training, transfer education, and many other patient safety factors that we need to eliminate the actual safety, and this will allow us to do that.
So throughout our research, we noted some limitations as well as some future research opportunities. I'm pretty sure most of you already have the question in your head about feasibility. I think it's important with feasibility to understand that this is a new technology, and new technology tends to be pretty expensive. For example, even the first type of VR system was probably the Nintendo Wii, which is a gaming system. And when that first came out in 2006, it was only $250, when today, or even just 6 years later in 2012 and today, it's around $130 or less, depending on where you buy it from. So these do come down in price. That being said, the more advanced ones are a little more expensive, some of them upwards of $11,000. But if you compare that to other therapy technology that we already use in practice, is that really a high price? But all that being said, there needs to be more research to determine if the benefits that we've noted and the benefits of the research in whole, if they really outweigh the cost of the different things. And then next, another more research needs to be done to develop protocols for VR in practice. We have protocols for pretty much everything and rules of how we should do it. And these are important to ensure patient safety, for our reimbursement purposes. Obviously, that's a big one, and as well as the likelihood of facilities in the future using VR. And then finally, one thing that we really noticed, because it is an emerging practice area, because there wasn't a lot of research, a lot of the studies had smaller sample sizes. And this is just, to note that they were smaller, so some of them might not have the best results. However, there were results there.
So just again, another limitation was there's not much on education using VR that is OT specific. It was a lot of nursing. It was a lot of surgeon. So I kind of had to dig through a lot of that to even find the benefits, but those benefits apply to OT very well as to other disciplines. And then just another limitation, and really just a future research opportunity, is to just create variety in what's available. So there was a lot of research that focused most on motor rehab and neuro rehab, but not so much. There were a few pieces on ADLs and a few pieces on autism and social behaviors, but there needs to be more to show how this can be used for all areas of OT that we address, because we don't just address 3 areas. We address many areas, so this needs to be expanded to show that. And then to sum it all up, if we could do all of this and use what we have, what's available now to further this research, we can enhance the safety, client-centered, and occupation-based care that we feel as important as OTs. And anybody have any questions?